Alright, that brings us to the last section we're going to cover here, some general rehab concepts for the wrist and hand. Just some terminology you're going to want to be familiar with, some examples of some exercises that you might be able to do. So first of all, we'll look at the various grips and prehension pinches. So a hook grip, like we would use carrying a suitcase. Cylindrical grip, lots of times I'll use like a roll-up ace bandage, and they can perform gripping exercises there. A spherical grip, like we would use with grasping a ball. And then a fist grip, which is like we would use in our typical closed hand position for performing a deadlift, something like that. Prehension pinches, digital, we see held between the tips of the fingers. Lateral grip, like we would hold a key, where the lateral aspect of the finger and the tip of the thumb. And then a pinch grip, where we are really tip to tip, as opposed to digital, where it's more pads of the fingers. Okay, one technique we might use, this would be particularly beneficial for like our carpal tunnel patients where we're concerned that they've got an adhesion from the surgery, is a palmar myofascial release, where we're actually just kind of cranking their palm out into this stretched position. Typically we'll do this for 2 to 3 minutes. We will oscillate as far as force goes, allow that tissue to kind of reperfuse, and then perform that stretch again. So we'll go over this a little bit in lab. Our isolated tendon gliding exercises. Just keep in mind we're going to stabilize at each individual joint. So I might do DIP flexion and extension, and then PIP flexion and extension, and MCP flexion and extension. And just slow, controlled, having them move through that range of motion. Okay, once I've isolated the different segments of the phalanges, then I go to more full hand grips. So we do kind of this claw shape, the fist shape, and then the finger flap, where we're just trying to make sure we've got good motion through the soft tissue, through the tendons that cross the wrist joint. Okay, super simple alternatives for wrist strengthening. We would do these supported on off the edge of the table, so wrist extension with a light dumbbell, wrist flexion with a light dumbbell. Ulnar and radial deviation, we use a single-sided dumbbell, or a sledgehammer works as well. So here we see ulnar deviation, here we see radial deviation. Pronation, supination. Eccentric work is always good with a band, because we've got more force added as we stretch that band. So 2 count on the concentric side, 4 count on the eccentric side would be a good approach here. Notice the patient, our posture's not so great here, a little bit better here. We adjust that table height to make sure she's in a good neutral position and can move accordingly. So just a simple piece of PVC and some TheraBand, and we're good to go. TheraPutty, here just manipulating the putty is exercise enough. So just having them kind of work it, making it pliable. In this example, they fashioned it into a loop, kind of rolled it out, looped it around the fingers, and now are using wrist flexors to pull it out into a stretched position. Same thing here, grasping it into a kind of a log shape and extending it out. Here we've got bilateral ulnar deviation, and here we've got ulnar and radial deviation, where they're stretching it out, alternating which direction they go. Using that spherical grip, hook grip, and fist grip, we can compress that putty, try to squeeze it out. We can also use our prehension pinches with the putty. Okay, so here we see our normal prehension pinch. Here's a lateral prehension pinch, and then using also the second ray, or third ray rather, a second finger to add to that motion. Working the intrinsics, we can use that putty to move into flexion, and then we can subsequently use the extensors to spread it back apart. Okay, finger adduction, squeezing that putty out, watching it expand on the ends. If you use kind of the name brand putties, it should be color coded the same as your normal TheraBand, so your red, your blue, your black. Yellow usually is going to be the lightest. It is sold by a number of other manufacturers that don't use that same. Actually, believe it or not, that color progression that TheraBand uses is copyright protected, so you can't just copy their yellow, red, blue, black type progression. So green like this, I don't know what brand this is. It may or may not be particularly pliable. Okay. Some other examples here: fashioned into a ring so that we're abducting, with just the fingers, no thumb involvement, and then abducting with just first and second digits. We can also use rubber bands for kind of the same approach. So you see abduction here, here, here. Some other alternatives. We've got these two in the lab. We used to have these, but they've disappeared since we've moved into the lab. This is a power web. The ones we have are actually double-sided, so they're stronger on one side than the other. I think there's a yellow and a red and a blue and a black, if I'm not mistaken, but I could be wrong. So we can use these for gripping. We can put our fingers in the holes, use it for spreading. We can also use these almost like a body blade and oscillate back and forth while we're gripping. Sometimes we'll have them hold that position as we move, almost like a steering wheel. So that's a little bit more feedback. These, you can actually buy these at Guitar Center, believe it or not. These are called Digiflex tools. And what you see here is there's a single side that's all one piece, and you can see with the black part removed, it's all one piece. And on the opposite side, there are 4 individual springs so that each finger is moving independent. These two are color coded according to the stiffness of the spring. So you see some varieties of finger movements that your patient could use. This is a TheraBar. We can use this for opposition twists, pronation, supination, lots of varieties of exercises here. It's kind of an alternative to putty that's maybe not as messy. You don't have to worry about keeping it in a container with a lid on it, that kind of thing. Alright, well that's it for wrist and hand and elbow. I won't see you before Thanksgiving. I hope you have a great break, and I will see you when I return Monday after next. So happy Thanksgiving, and I'll see you soon. Take care.